My name is Malik Phillips. I am a graduate student in the School of Public Health through the School of Medicine. I come from a small town, and so during my undergrad, I learned about social determinants of health. And so when I was learning about it, I thought about my upbringing, and so how I saw these social determinants of health, but I never knew how to define them. And so when we look at access to care, things of that nature, that all related to this project. And so when Dr. Richardson and Dr. Harris asked me if I would like to take part, I couldn't turn it down. I was really interested in access to care, so that was one aspect of the study that I wanted to look into. Some of the mothers talked about how they felt they didn't have proper access to prenatal care, as well as they didn't have access to the birth outcomes that they would have expected. So the majority of mothers said they wanted to have their births at home opposed to having birth in the hospital for various reasons that was not possible. Most of which came either down to access to care or access to insurance. So we determined two major themes when analyzing the transcripts from both the mothers as well as the nurses. And those two themes were pain and treatment management, as well as the use of protocols to mask bias within the medical system. Many of the mothers talked about how their pain was not properly managed or how they felt they were mistreated during their delivery experience. The nurses would talk mainly about protocols. Prior to joining the Master of Public Health program, I knew that I wanted to do something medical related. I didn't want to go to medical school. I didn't want to be a medical doctor. I was more interested in policy, but after entering the program and learning more about it, I fell in love with qualitative research. It provides a lot of informative analysis, but behind those numbers is a person. And each of those people have a story that can be told when qualitative is coupled with quantitative research. And so just focusing purely on the quantitative, that story is lost. And so I enjoy the one-on-one interaction with talking to individuals, learning their stories, making them feel as if their story is important because they make up the numbers that gives us topics to research. One of the things that I really enjoyed about the program is the support of nature. We were able to get together and talk about our research as well as different classes. Biostatistics is one thing that we all sort of gathered around and we could teach one another, as well as the faculty is incredibly supportive throughout my 2 years in this program. This program is second to none if an individual is interested in a Master's of Public Health.